Thank you, Sahani sir and Dr. Mani Singh Saad and those who attend in this session. Good evening, good afternoon, and good morning. This is the 2138th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Professor Dr. Pallavi Patil. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30, and from 8:30 to 9:30, the international session in English, and from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself, so that those who miss the session can watch it, and you can subscribe the same without paying any money. You can share it with anyone who loves homeopathy. The purpose of this forum is to take homeopathy to every home around the world. And we have so far uploaded more than 3,850 videos on YouTube. You can see, search IFPH homeopathy at YouTube to see the videos. And let me come to today's guest. Today we have a wonderful guest in Professor Dr. Pallavi Patil, and she has completed MD and doing PhD, and is a professor in the Department of Homeopathic Material Medica, housed by Homeopathic Medical College and Hospital, Nimshukar, Kolatpur, Maharashtra. And the topic of discussion is effectiveness of GYMNEMA Sylvestre tincture in homeopathic management of type 2 diabetes, a pilot randomized controlled trial. If this kind of studies are very essential because we can show the world that how homeopathic medicine works in situation like the lifestyle diseases. But lifestyle diseases, as you know, there is no permanent treatment in allopathy, but they are just managing. But homeopathy can do a different has a different methodology of treatment. And so let us see what the Professor Dr. Pallavi Patil has to say about it. Welcome, madam.
Good evening, sir. Thank you. Thank you so much. Myself, Dr. Pallavi Patil, working as a professor in the Department of Homeopathic Materia Medica at Hausabai Homeopathic Medical College, Nimshirgaon, Kolhapur, Maharashtra State. So today's my topic is diabetes mellitus and the role of homeopathic management, especially of the GYMNEMA sylvestre. So diabetes first. I will tell you history of the diabetes mellitus. Diabetes mellitus is taken from the Greek word diabetes, meaning siphon to pass through, and the Latin word mellitus meaning sweet. A review of the history shows that the term diabetes was first used by Apollonius of Memphis around the 250 to 300 BC. Ancient Greek, Indian, and the Egyptian civilization discovered the sweet nature of the urine in this condition, and hence the propagation of this world diabetes mellitus came into being. Mary and Mincox in 1889 discovered the role of the pancreas in the pathogenesis of the diabetes. In 1922, Banting based and the Coley purified the hormone insulin from the pancreas of the cows at the University of Toronto, leading to the availability of an effective treatment for the diabetes in 1922. Over the years, exceptional work has taken place and multiple discoveries as well as management strategies have been created to tackle this growing problem. Unfortunately, even today, diabetes is one of the most common chronic disease in the country and worldwide. In the US, it remains as the seventh leading cause of death. So, introducing diabetes mellitus is a group of metabolic diseases in which there are high blood sugar levels over a prolonged period. So, symptoms of high blood sugar include the frequent urination, increased thirst, and the increased hunger. If left untreated, diabetes can cause many complications. diabetic ketoacidosis, non-ketotic hyperosmolar coma or death. Serious long-term complications include heart disease, stroke, chronic kidney failure, foot ulcers, and damage to the eyes. Diabetes is due to either the pancreas not producing enough insulin or the cells of the body not responding properly to the insulin produced. So we all know cause and the everything about the diabetes. So there are three main types of the diabetes mellitus: type 1 diabetes mellitus, type 2 diabetes mellitus, and the gestational diabetes. So type 1 diabetes is very uncommon, or type 1 diabetes mellitus is also called juvenile diabetes. So this results from the pancreas failure to produce the enough insulin. This form was previously referred to as a insulin-dependent diabetes mellitus or juvenile diabetes. The cause is unknown for this type 1 diabetes mellitus. Type 2 diabetes mellitus begins with the insulin resistance, a condition in which cells fail to respond to insulin properly. This form was previously referred to as a non-insulin dependent diabetes mellitus or adult onset diabetes. The primary cause is excessively body weight and not enough exercise. Gestational diabetes is the third main form and occurs in the pregnant women with a previous history of the diabetes. So we will compare the type 1 and type 2 diabetes. The feature of the first is the onset of the type 1 diabetes is the sudden. Type 2 has the gradual. Age of the onset of type 1 is mostly in children. Type 2 is mostly in adults. Body size thin or normal in the type 1, and type 2 often obese. Ketoacidosis is common in type 1 diabetes mellitus, and ketoacidosis is rare in type 2 diabetes mellitus. Autoantibodies is usually present in the type 1 diabetes and absent in the type 2. Endogenous insulin low or absent in the type 1 diabetes mellitus, normal, decrease or increase in type 2. Concordance in identical twins 50% in the type 1 and 90% in the type 2. And prevalence of the type 1 is 10% and prevalence of the type 2 is 90%, average 90%. So these are the signs and symptoms of the type 1 and type 2 diabetes mellitus. The blue line indicates the type 1 diabetes mellitus. So that is the smell of acetone, nausea, vomiting, abdominal pain, Kussmaul's breathing or hyperventilation, weight loss, lethargy, stupor. So these are the symptoms and signs of the type 1 diabetes mellitus. Type 2 diabetes mellitus have the polydipsia, polyphagia, then blurred vision, polyuria, glycosuria. Included again these signs and symptoms. So classic signs and symptoms of the untreated diabetes are weight loss, polyuria, polydipsia, polyphagia. The symptoms may develop rapidly weeks or in months in the type 1 diabetes mellitus, while they usually develop much more slowly and may be subtle or absent in the type 2 diabetes mellitus. So also included blurry vision, headache, fatigue, slow healing of the cuts and itchy skin. Prolonged high blood glucose can cause glucose absorption in the lens of the eye, which leads to changes in its shape, resulting in vision changes. A number of skin rashes that can occur in diabetes are collectively known as diabetic dermatodromes. So these are the complications like cardiovascular, blood diseases, peripheral vascular diseases. So all forms of the diabetes increase the risk of long-term complications. These typically developed after many years, after the long-standing or chronic diabetes, after the 20 years, 25 years. The major long-term complications relate to damage the blood vessels. Diabetes doubles the risk of the cardiovascular diseases. About 75% of the deaths in diabetics are due to coronary artery disease. Other macrovascular diseases, that is the stroke, peripheral vascular diseases. The primary complications of the diabetes due to damage in the small blood vessels include the damage to the eyes, kidneys, and the nerves. Damage to the eyes, known as the diabetic retinopathy, that is damage to the blood vessels in the retina, and can result in the gradual vision loss and the blindness. Damage to the kidneys, known as the diabetic nephropathy, so can lead to tissue scarring, urine protein loss, and eventually chronic kidney disease, sometimes requiring dialysis or the kidney transplant. Damage to the nerves of the body, known as the diabetic neuropathy, is the most common complication in the diabetes. So, we will continue the complications like the diabetic foot or the muscle wasting. The symptoms can include the numbness, tingling, pain, and the altered pain sensation, which can lead to damage to the skin. Diabetes related foot problems, such as the diabetic foot ulcers, may occur and can be difficult to treat, occasionally requiring amputation. Additionally, proximal diabetic neuropathy causes painful muscle wasting and weakness. That is the diabetic myotrophy. So we will see the in general pathophysiology of the diabetes mellitus. In short, insulin is the principal hormone that regulates the uptake of glucose from the blood into the cells of the body, especially liver, adipose tissue, and the muscle, except the smooth muscle, in which insulin acts via the IGF, that is the insulin-like growth factor 1. So therefore, deficiency of insulin or the insensitivity of its receptors plays a central role in all forms of the diabetes mellitus. So I excluded type 1 pathophysiology. So here we will recall the pathophysiology of type 2 diabetes mellitus. Type 2 diabetes mellitus is characterized by the insulin resistance. The defective responsiveness of body tissues or the insulin is believed to involve the insulin receptor. In the early stage of the type 2, the predominant abnormality is reduced insulin sensitivity. Type 2 diabetes is due to primarily to lifestyle factors and the genetics. So these are the risk factors for the type 2 diabetes mellitus, that is obesity, sedentary lifestyle, then unhealthy eating habit, family history, and the genetics. So these are the herbal drugs treatment for the diabetes like Acacia arabica, Acanthis aspera, Allium sativa, Allium cepa, Azadirachta indica, Tinospora cordifolia, cinnamon, bitter melon, fenugreek, and GYMNEMA. So these are the some diagnostic criteria for the diabetes mellitus: HbA1c, then fasting blood glucose, then oral glucose tolerance test, diabetes, pre-diabetes, and the normal. So we have these ratios. Now I am sharing my topic. So that is the effectiveness of GYMNEMA sylvestre mother tincture in the homeopathic management of the type 2 diabetes mellitus. It's a pilot randomized controlled trial. So already we discussed this metabolic diabetes. Regarding the diabetes, it's a metabolic disorder characterized by elevated blood glucose levels affecting the quality of life, daily functioning. So despite of availability of the treatments such as insulin and oral hypoglycemic agents, diabetes remains a major global health concern associated with the serious complications. So we have the drug that is the GYMNEMA sylvestre. It is called Gurmar, a traditional medicinal herb, helps to reduce intestinal glucose absorption and the sugar cravings through its active constituents, that is the gymnemic acid. So it contains the gymnemic acid. So aims and objectives of my study: to evaluate the effectiveness of GYMNEMA sylvestre mother tincture in the management of type 2 diabetes mellitus after 12 weeks of the treatment. So objectives like to evaluate the clinical conditions of GYMNEMA sylvestre mother tincture in patients with type 2 diabetes mellitus, to evaluate the clinical course of the patients receiving GYMNEMA sylvestre mother tincture in cases of the type 2 diabetes mellitus. So these are the objectives. So methodology, I have selected the study design, that is the pilot randomized control trial. Study population: diagnosed patients with the type 2 diabetes mellitus. Study setting: outpatient, indoor patients. Then indoor patients from our college, that is the late Mrs. Houseaway Homeopathic Medical College. Then sample size is 10. Sampling technique is a simple random sampling was used to allocate the participants into the trial group and the control group. So methodology: inclusion criteria: patient age 30 years and above were included. Patients receiving the oral hypoglycemic therapy. Patients with the HbA1c levels between 5.6 and 9 with or without clinical symptoms. Only patients requiring GYMNEMA sylvestre mother tincture were included in the trial group to evaluate its effectiveness and the clinical utility. Patients of the all genders were included. So these are the included criteria. Exclusion criteria: patients with the complications of the diabetes mellitus, immunocompromised patients, pregnant and lactating women, patients receiving exogenous insulin therapy. So methods of measurement: fasting blood sugar and the postprandial blood sugar were measured at the baseline. HbA1c levels were assessed before treatment and after 12 weeks. A detailed homeopathic case history was recorded for patients in the trial group to evaluate the clinical indications of the GYMNEMA sylvestre mother tincture. Outcome assessment tool: fasting blood sugar and the postprandial blood sugar. Intervention used: participants in both groups were advised to continue their usual diet and the lifestyle. Participants were instructed not to use any vitamin or herbal supplements during the study. GYMNEMA sylvestre mother tincture was administered as 15 drops orally 3 times daily. So these are the results. So all 5 patients in the treatment group showed improvement with greater reductions in the fasting blood glucose, postprandial blood glucose, and HbA1c levels compared with the control group. No adverse effects were observed during the study. In the control group, only 3 patients showed mild improvement. This is the pilot study, suggests the GYMNEMA sylvestre mother tincture may be an effective and the well-tolerated adjunct in the management of the type 2 diabetes mellitus. So this is the discussion part. Type 2 diabetes mellitus is characterized by insulin resistance and impaired insulin secretion, resulting in chronic hyperglycemic, which can lead to vascular complications such as retinopathy, nephropathy, and the neuropathy. Homeopathy aims to manage type 2 diabetes mellitus holistically by addressing the underlying miasmatic factors, stimulating the body's self-healing mechanisms, and using individualized remedies ranging from mother tinctures to LM potencies to support glycemic control. GYMNEMA sylvestre exhibits anti-diabetic activity by stimulating insulin secretion, promoting regeneration of the pancreatic islet cells, enhancing glucose utilization, and inhibiting the intestinal glucose absorption. So this is the conclusion. of my study. This pilot study suggests that GYMNEMA sylvestre mother tincture may be effective in reducing the fasting blood sugar glucose, postprandial blood glucose, and HbA1c levels over a 12-week treatment period. Larger randomized control trials are required to confirm these findings. So these are the references. So thank you so much from Research and Innovation Committee of late Mrs. Hausabai Homeopathic Medical College and Hospital, Nimshirgaon, Kolhapur, Maharashtra. Thank you so much, sir. Thank you.
Yes, madam, what happened?
हाँ sir.
Hello?
हाँ sir.
What happened, madam? Hello?
Sir, complete. I have completed, sir.
Within 20 minutes. So you can say, present some of your cases here because we have for half an hour remaining. So you may present some of your successful stories or cases so that others can watch it and we can have a discussion later.
Okay, sir. So I will tell you, sir, the role of gymnema in the diabetes. I know cases, but I don't.
Whatever be the case, no problem. You can raise anything from your case sheet.
Action of the gymnema sylvestre. Gymnemic acid molecules fill the receptor location in the absorptive external layers of the intestine, thereby preventing the sugar molecules absorption by the intestine, which results in the low blood glucose level. So, how the gymnema acts in diabetic patients? So, GYMNEMA sylvestre leaves have been found to cause the hypoglycemia in laboratory animals and have found in use in herbal medicines to help treat adult onset diabetes mellitus. When the GYMNEMA lead extract is administered to a diabetic patient, there is a stimulation of the pancreas by virtue of which there is increase in insulin release. There are some possible mechanisms by which the leaves and especially the gymnemic acids from Gymnema sylvestre exert its hypoglycemic effects are. It increases the secretion of insulin, it promotes the regeneration of islet cells, and it increases the utilization of the glucose. It is shown to increase the activities of enzymes responsible. So this is all about the anti-diabetic action of the gymnema. Enzymes responsible for utilization of the glucose by insulin dependent pathways. As increase in the phosphorylase activity, decrease in glucosinonic enzymes and the sorbitol dehydrogenase. It causes inhibition of the glucose absorption from the intestine. So, how gymnema act as a anti-diabetic action? So, I have cases, but but here I don't have cases.
Panda sir, you can add something more, sir.
Yes, sir. Thank you, sir. I would like to request Madam, being a professor of Mathematics, so other similar remedy which are being used for the treatment and management of diabetes mellitus type 2.
Yes, sir. So we have the Cygegium jambulum, then phosphoric acid. Acid phos also important drug to reduce the blood glucose level. Cygegium, then acid phos, lactic acid.
So there are so many remedies for diabetes mellitus. and as a homeopath, we need to select the medicine on the basis of totality of the symptoms. Syzygium,
Yeah.
Jambulicum, Cephalenda, Indica. So these are the medicine-specific remedy. Therapeutically, it can be used just to control the sugar level. But uh, nowadays, most of the diabetes there, what I'm telling, uh, stress-oriented diabetes. So when the
Yes.
person becomes stressed, then it will leads to reflect in physical level in form of different diseases. One of the diseases is diabetes mellitus. So on the basis of stress, we can select medicine, and nowadays we can see that the type 2 diabetes mellitus is prevalence in young age, even young adult. So that is because of stress and some,
Stress.
yes. So there are so many remedies you can select on the basis of stress. So your research work is on a particular medicine, but there are so many medicines which can be prescribed on the basis of stress. So I expect that on the basis of stress, what are the medicines generally indicated? Can you share with us, madam?
On the basis of stress, like sir, constitutional medicine, considering the mental symptoms are very important, and the constitutional medicine. So we can prescribe like the stress, anxiety, arsenic, then stress factor, also Kali group.
So on the basis of hereditary, suppose the parents they are
No
suffering
source
from.
we can consider, na sir? Hereditary, more genes dominating psychotic dominance. So diabetes, psychotic dominance expresses.
So every disease that starts in sora and ends in syphilis. So stress basically it starts in sora. So not necessary that all the diabetes they are psychotic in origin. So if we discuss the miasmatic phases of different miasms, which plays role apart from therapeutic medicine or medicine which are prescribed in acute condition like Syzygium jambulicum, Cephalentera indica, Methi mother tincture. So these are different medicine can be prescribed to control the diabetes, control the acute problems. But whatever the constitutional medicine it can be prescribed for sustenance of that control.
Constitutional drugs like phosphorus also, then arsenic, lycopodium, depends on the mental and physical, patients.
As Dhanesh sir told, so let us discuss that what type of if in which condition we need to prescribe lycopodium, in which condition we need to prescribe phosphorus, whatever the
So
constitution.
Lyco and phosphorus is different constitution. So lyco patient is but rather than lycosa, Naxomica patient is type 1 personality. Patient always wants everything in the neat and order. So, along with their addictions, or we can say the diet, and so Nux is prescribed on the basis of the constitution, like mentals and the dietary factors.
Even the Kali group of patient they belongs to type 1
So
personality.
Kali, yes, yes, Kali is very anxious patient, very anxiety, fear of alone. So always thinking about the family members and the fear when he or she alone, and that is the anxiousness can cause the stress and lead to the goes to the diabetes.
For your dissertation purpose, you must have taken more than 40 cases. What I am thinking in PG. So there is a control group as you mentioned, right? And you prescribe medicine in certain groups. And in the what about your study? That is randomized study.
Randomized,
Randomized. So what?
randomized clinical trial,
So
pilot studies,
what are the similar?
randomized clinical.
What about the percentage of benefit the patient you have selected on the basis of inclusion criteria? Inclusion criteria.
Inclusion criteria like, sorry,
What about your inclusion criteria?
sir, more 30 age is more than 30 years. Then blood HbA1c between 5.6 to 9. Then not more complicated cases. These are the inclusion criteria.
So, have you included any patient who are taking anti-diabetic drugs like metformin, etc.?
हाँ included sir, but शुगर लेवल यहाँ पे तो ज्यादा नहीं कंसिडर किया, और मोर देन 60-70 years के एज की भी नहीं कंसिडर किए सर.
ठीक है, you have having a age limitation, but what is my question that when the patient those who are taking anti-diabetic drug, in those cases you must have prescribed your medicine.
Yes sir.
So then how can you judge that whether your medicine is working or that metformin is working?
सर आई हैव मीन्स उसका रिकॉर्ड तो अलग रखेंगे ना सर. व्हेन पेशेंट वाज ओनली ऑन ओरल डायबिटिक मेडिसिन, and I have studied the control group and the trial group sir.
So you have purchased the medicine from which company?
SBL.
SBL. So I would you must have passed your dissertation topic dissertation in your ethical committee institutional, right?
Past.
Then
Past.
whether you are doing the test or examination every fortnight.
Sir, I now I have presented the pilot study.
So you have presented the pilot study. So whatever
Yes, yes.
what about your projection?
10 cases only I have present. What?
What about your projection in future prospect?
Sir, effectiveness of the Gymnema mother tincture in the type 2 diabetes mellitus, it's a randomized clinical trial study.
What outcome you are expecting?
They were expected
So in your pilot study, definitely you have mentioned the outcome, the objectives. Nowadays, in our OPD and in our hospital, so many cases are coming of diabetic foot, and we are
yes, sir.
treating it. So whether you are
Uh,
getting such type of cases in your hospital?
so these are the objectives like Gymnema mother tincture, evaluate the clinical indications, and these are my objectives, sir. To see how to evaluate the effectiveness of Gymnema mother tincture in the management of the type 2.
Can it use
Well,
as a preventive medicine? Suppose there is
uh,
history of
if,
diabetes of parents, and
yeah,
can you prevent the offspring? That means those who are more than 30 years prescribing this medicine to prevent diabetes.
sir, we can prevent, we can use, no, sir. We can prevent. Suppose if family history is strong diabetes, so we can we can prevent mother tincture.
So, is there any
If
dietary?
patient suffer from the stress factor and earlier some signs and symptoms, so we can give.
So, in this case, in pilot study, what about the auxiliary management of the case? What type of auxiliary management you will take in your pilot study apart from medicinal?
Auxiliary, so that is to advise all things like to avoid the stress and to avoid restrictions about the food, sweet foods like and supportive vitamins, other medicines.
Is there any need of yoga and exercise? Is it helpful?
Yes, yes, yes,
How?
yes, yes.
How?
Definitely yoga and exercise compulsory. Through the meditation, we can do the our life is very easy or very what we can say um, release factor, releasing our the mentals through the yoga and the stress factor through the yoga and the exercise.
So can yoga and exercise will control the increased blood glucose level?
Um, it is quite possible, sir. It is not, uh, but in the within limit, if there is blood sugar or HbA1c, so can control the if pre-diabetic is 6.4 or something. So without medicine, we can control through the yoga and the exercise and the walking, daily walking, exercise.
Should you think that the anti-diabetic medicine can be stopped in tapering manner if
Can we before starting, sir, we can. So
that can
बीच में नहीं कैसे स्टॉप नहीं कर सकते सर. So if patient diagnosed pre-diabetic as a pre-diabetic, so we can advise to patient to do the regular yoga and dietary restrictions and the exercise, daily walking. So pre-diabetic का हम
after
control.
administration of our medicine, gymnasia, whatever it may be, or your CGM jambulicum. So if you'll get benefit, that means if the patient will come in control group, means diabetic, the sugar level is reducing. So can the anti-diabetic
Step
medicine,
by step, sir, step by step, we can reduce the dose of allopathic medicines
that means in tapering manner,
in tapering
with exercise and yoga?
with exercise and yoga.
We know that the diabetic sugar is the root cause of so many diseases. That means kidney failure, then
Yeah, yeah,
retinopathy, neuropathy, food, diabetic food. So many diseases are caused by even heart diseases.
heart
Right?
disease.
So,
All complications.
so
Basic blood disease, coronary disease.
all the root cause may be diabetes, one of the root main cause. So diabetes, when the patient is under treatment, so what are the precaution we need to take, or what advice we have to give to the patient for slow progress?
Slow progress of what, sir?
Slow progress of, suppose our medicine is working and
Hmm.
the HbA1c level is decreasing from 8 to 6. So what advice we should give to the patient for sustenance of this? That means what are the obstacles may come in the path of our cure?
Hmm. Stress factor.
Number one, stress factor. That means we have to advise the patient to remain calm and don't
Yeah,
get
yeah.
stressed in business. Number one. Number two,
Food,
food, we need to restrict the oily food, fatty food, and
oily food,
sweet food,
sweet
sweet.
food,
So these are
junk food,
junk food.
junk food.
We have to give advice in food. Then about lifestyle, because
Yes,
lifestyle
have
disorder.
to change the lifestyle.
What type of change we
Also,
can do, sir, madam?
so must take the 6 to 7 hours sleep.
Right. Second,
Mm.
actually we have having time. That's why I am discussing with you. Uh,
Yeah, yes, sir,
yeah.
sure, no problem, sir.
Uh, so that's why I am interacting with you to know something else. So in
Yeah.
lifestyle activities, number one, sleep. There must be 6 to 7 hours sleep. Number two, stress oriented. To release the stress, we have to do exercise
Yes.
or yoga. Then other things, physical exercise should be done.
Yes. So, but sir, a light physical exercise. Hmm. Walking, daily walking, compulsory 45 minutes
Right,
walking.
right, madam. Then
Hmm. Then food, already diet and food and all these things.
what about working style? Those who are
Working,
the
mm,
working environment must be suited to that person. If
must be healthy.
yes, so suppose you are a professor, you are doing all the work there at college as well as in clinic as well as in home. So it should be duly coordinated.
Yes, healthy climate should be there.
That means a disciplined life is needed apart from the
Discipline.
medicine. So what type of discipline we can maintain?
Discipline. So must complete in time work and whatever may be the targets and these all things, or in time whatever daily routine schedule in should be in time, or lunch, breakfast, or whatever may be in routine in schedule.
Right.
So not should be lengthy, or not should be in irregular.
So we in a clinic in day-to-day practice, what happen in certain cases, in spite of selecting good medicines, in certain cases you are going to fail. So that case may be due to diabetes. So in which type of cases we have to investigate sugar level if you are getting fail in a treatment. For
What, sir?
example, a person is suffering from pruritus. If the person is suffering from
Hello?
pruritus, then that may be due to
Pruritus. Hello?
Yes.
Pruritus.
yes,
Hello?
pruritus.
Pruritus. Huh.
So that may be due to sugar. A case,
Sugar. Huh.
a case of in young age or a urticaria in young age may come. So when you get fail, in spite of selecting a good medicine like urticarians or for itching sulfur, then if you are getting fail in that case, so we must investigate the sugar level.
Yes, madam. It is a really a very interesting discussion going on. Anyway, your presentation was excellent, and you have proven that the silver surgeon's danger works for homeopathy. But if we think if we homeopaths are trying to prove these medicine as per this randomized kind of study, what will be the future of homeopathy? That is the big question, because homeopathy is a system which is based upon individualization, and but we are trying to prove the world that we are also scientific as per the rules suggested by the WHO or the so-called modern medicine, the old school of medicine, that we can say homeopathy is the most modern medicine. And what we are trying is we are trying to prove the same methodology. But actually, this kind of studies are really good. That homeopathy medicine has content in it, and we are trying to prove in that way. Once we go in that way, what will be the position so that homeopathy people can use this as a specific medicine for homeopathy management of diabetes. But that is as per our theories, as per our laws, it is against. But we can find a constitutional medicine first, and then we can give this medicine, these tinctures to manage the situations.
So that
Just like
evidence we must have with us, sir. So as
yes,
you told, so the scientific world will believe on our system if you keep evidence, and that in this case this was the case, and this is the evidence of blood sugar level, after prescribing this medicine this changes takes place. So if we collect this evidence and we systematically analyze it and we will publish it in journals, then only we can justify our system. What I am thinking.
But the end of the road will be different, sir.
Yes, sir. We
We
treat the
can prove
patient.
in,
We are treating the patient, not the disease. But
yes,
now the scientific world, they want evidence.
yes, that's the reason why because we will have to prove that world that the homeopathy is a super science rather than the because all other science have always believe in changes, but homeopathy is having a fixed law and a fixed system methodology of treatment.
Yes, sir. In conventional medicine, they believe in matter and motion, and
Yes,
in material dose, because they believe in material existence. But we are not believing on material existence. Our science is based on the philosophy that is substantialism. So we cannot give any proof that how our medicine is working. Only you can show it in evidence that after administration of this medicine, in out of 100 cases, 80% of cases are being responded. So that can we do, but we cannot. It is not possible because our science is dynamic one, and we are treating the patient in holistic point of view as a the patient as a whole. So it is not possible like allopathy that the medicine was working like this, and that's why this result came. But when we administer in 100 cases of the same medicine, we can take the data, and that data can be published in good journals by which homeopathy can be flourished. What I am thinking, sir.
yeah, that line of thinking is also good because the so-called modern people will not agree with our science and they will not agree with our laws. But the action of our medicines are entirely different. And once they start using this medicine, then they will convince that they may convince that homeopathy is having is a most modern scientific.
Till then, the some engineers in Bhaba Atomic Center, they are doing research in nanotechnology. Our medicine is working like this because after the 12C or 24X, there is no material content in the medicine. Till our medicine is working on that way. They are searching, and the research is going on, and they are proving that homeopathic is working in the method of water memory mechanism. So this type of research must be done to prove our medicine, to prove the efficacy of our medicine. If you tell Sora, syphilis, psychosis, or substantialism, vital force, the material world, the modern physiology is not accepting it. So the new generation, they should do more and more research and collect the data, analyze the data, and prove that our medicine is working, and out of 100 cases, 80 or 90 cases are effectively cured or controlled. So that should be done. That is the need of the era, sir. What I am thinking.
Yes, the modern era, we will have to think as per the guideline given by the WHO, and we will have to set aside our principles and move in that way. But in between, we have to bring the notice of these things to them also.
Just before 4 days, I received a letter from Balaban. He is the scientist of that great laboratory situated there at Noida, the Wilmer Swabe, that homeopathy is going to be discarded there at Germany. So we have to we need your help, and you write letter unanimously that it should not be discarded there. So that the cause is that how homeopathic is working and scientific evidence. So we are doing good practice in homeopathy is flourish in India, but it is also our responsibility to flourish homeopathy in scientific manner, by which it should not be discarded in developing country.
Yes, sir. That's the reason why IFPH is taking such a wonderful job of making sessions day by day, because we have criticism from these people that there is no homeopathy anywhere other than India. But we have eminent doctors from different parts of the world coming over here and saying their successful stories. And that is the first indication that their homeopathy is still there in those part of the world.
Sir, we are
Even
very much thankful to IFPH because we are learning so much thing in different manner, in different way, and I hope definitely it will be record in Greenwich World Book
yes, sir,
once. But
already it is a Guinness record, but unfortunately, since we were not uploading our this schedule day by day in our website earlier, they are not considering this for Guinness record. That is the biggest problem, challenge in front of us. Nowadays, we have started uploading the videos and we not only videos but the posters every day.
so I would request all the authorities to work in such a manner by which, though we are trying our level best, that once the IAPH must be come in Greenwich World Book, by which throughout the world it will be one of the branding platform for development of homeopathy, sir.
Yes, sir. Most of the doctors in other part of the world saying that the IAPS is doing some great work in that way, connecting between doctors around the world. And at the time of COVID, the Turkey was not under homeopathic treatment, but once we have started these things, the doctors from there come together, and we have given request to the ministry, and they agreed to go ahead with the treatment. So that is the that kind of inspiration we can give to the doctors who from
Let us
our.
try to invite more doctors from European countries if it is possible.
Yes, sir. We were, but the thing is that only our timing and their timing is different. So only few people can come, and that is the biggest challenge in front of us. Otherwise, we will have to change our time in that way as per their convenience. That's a very difficult job for us.
So
That,
everything, sir, everything will be possible. Those who are Indians, those who are practicing there abroad in European
yes,
countries, you have to connect with them. We have to invite them to the platform to deliver
yes.
their lecture and about the existence of homeopathy in those countries.
Yes, sir. Sir, we have a presentation from Germany, that is Dr. Beatrice Gasta, Dr. Maria Salcedo from Bolivia, Dr. Kathy Meleman from UK, USA, it's, Obaidullah Hashmi from this Afghanistan, Dr. Javed Akhtar and team from Pakistan. So many, I can mention so many names here. So all of them were here, and they are having very good appreciation to homeopathy in India, because India is the country, it's supposed to be the motherhood for homeopathy nowadays.
IAPH is working marvelously. Till then, we should not be satisfied. We have to go ahead. We have to unite more and more colleagues, and
Yes, sir. Yes, ma'am.
the countries those who are not in support of homeopathy, that country we have to take in consideration, by which our homeopathy can be flourished, and the branding must be there in those countries, sir.
Yes, exactly, sir. Anyway, we will try in that way. Now it is the time to conclude the session. I am inviting Dr. Ramprasad sir to say vote of thanks to Dr. Pallavi Patil. Dr. Pallavi Patil, open your video, please.
Thank you, Dhanesh ji, and Namaskar, Dr. Panda sir, and congratulations, Dr. Pallavi Patil. Very nice, excellent session. Very nice, wonderful discussion for diabetes. So, on behalf of IFPH, whole team, very thanks, Dr. Pallavi
Thank you.
Patil.
Thank you.
Again, presentation. Thank you. Very thanks.
Thank you. Thank you.
Uh,
Thank you so much, sir. Thank you.
diabetes, Nigelia sativa is a very good remedy. Diabetes and GYMNEMA, Nigelia sativa,
Nigella
Mangrela,
Sateva.
very good remedy. Maintenance of
Thank you.
diabetes, not cure of diabetes. Thank you. Very thanks.
Thank you, sir. Thank you so much.
Thank you, Dr. Rambresa sir, Dr. Vipul Kumar Panda sir, and Dr. Pallavi Patil coming over here and delivering such a beautiful randomized study on Sylvester medicine on diabetes, action of that particular medicine on diabetes. Thank you. Thank you.
Anger suppression and insulty, familiar insulty.
Okay, sir.
Diabetes, Astifxeria is the suited remedy.
Okay, sir. Thank you all for joining the session. Tomorrow we will have a session from Dr. Rexis Rana, and he will be presenting a paper on deworming and homeopathy. With that, we come to the end of the day. Thank you all. Over to Dr. Maria Majoon to moderate the Malayalam session.